Welcome to another episode of the Beyond Data Management Podcast, powered as always by HS GovTech. I'm your host, Cameron Garrison. Thanks for coming by and spending some time with us here today. As you know, this show was launched and is dedicated to giving a platform to thought leaders and serious folks that are doing serious things in the environmental health field and community. And today's guest certainly fits that bill. She's got a very wide, well-balanced experience set and is currently the Director of Environmental Health and the Assistant Health Commissioner. So two hats there. Sarah Jensen from Franklin County, Ohio, which is the greater Metro Columbus area, joins us here virtually in the Beyond Data Management studio. Sarah, thank you so much for making the time to do this with us, and welcome to the podcast.
Hello, thank you, Cameron. Happy to be here to be able to discuss with everybody today.
You really have had quite a broad career, and of course now have landed in the big chair in Franklin County, which is not a small jurisdiction. Maybe let's just start, because we get a lot of user feedback, and a little bit later on today we'll actually share and talk about a couple of viewer feedback notes and comments we got. But maybe just start with how you got here. One of the things that I've observed, it's so interesting just in the early episodes here of this particular podcast, is how many folks that have risen in the ranks in environmental health were planning to do anything but that when they were, in their formative years, college, and trying to decide what they wanted to do when they grew up and for a living. And it's just remarkable how many people have that story. Let's start with yours, your journey, how you discovered environmental health and got here, and kind of the stops that you've taken along the way in several different roles, including industry, and leading up to where you are today in Franklin County.
Thank you, Cameron. Yes, that's a great story. So when I started out, I was there at Wittenberg University. I had grand plans and I had my life mapped out. I was going to be a research scientist. And along the way, I did need a job after graduating from Wittenberg with my bachelor's degree in biology. So I was looking around and I found an opening at Greene County Public Health. And so that's where I started out. Interestingly, I didn't even know the job that I took then even existed before I got it. But it was a fun thing to leap into. So
you literally found out it was available and applied for it. Up until that point, environmental health and what that entailed wasn't even something on your radar?
It was not. It was back at a time when, jobs were posted in the newspaper for you to be able to look at. And all it said was I needed a degree in science. And I was like, hey, I got that. Let's look at this.
What did you want to be? So when you first were in college, because going for a biology degree, you weren't trying to go for something easy. What was your original thought?
I really wanted to be a research scientist, which is an MD PhD. And I was looking at a program at The Ohio State University, but it was unlikely that usually you get in the first year. So I was planning on doing something for a year until I could get into that. So I was completely lab research focused. And so this wasn't on my radar at all.
Wow. And you got it right. You're a true Ohioan. You led with the all capital, the Ohio State. You guys will get grouchy with somebody if they leave that off.
Yes, it's a must know around here, and it's a great source of pride as we have a whole lot of brilliant minds, great sports, and all sorts of things from the Ohio State.
Yeah, it really is a powerhouse in sports and other things. In fact, we'll be talking today about some research and analysis that you've done that's fascinating. And one of those projects was with the Ohio State and some of the grad students there. So how long were you at Greene County? What was the role there? Was it the same role the whole time? What was your first, however long, at your first stop on the road at Greene County?
So I was at Greene County for about 6 years, and smaller health departments, at least here in Ohio, you tend to be more of a generalist. I still semi-specialized in food, but you get a lot of other exposure as well. So I was able to experience a lot of the environmental health programs there and be able to see that play out. And at the same time, I did work a second job because unfortunately there's not a high rate of pay. And so I did take a second job at Kroger. And so I was working there both during that time. And over those 6 years, I grew from a field inspector into when I additionally did plan reviews for the jurisdiction as well.
Wow. That's pretty common, isn't it? You end up. We had Van on. It was episode 3 from Marion, and he wasn't. He was actually well into his career before he found public health, but he did everything there, including maintenance and working on the maintenance team. There's a lot of that in environmental health, isn't there? You never have enough staff for everything you're asked to do, and you end up moonlighting and doing a lot of things that aren't just food or pool inspections.
Absolutely. It's very common, not only in Ohio, but across the United States, where folks have to wear many hats. There's just not the funding to be able to hire someone that is really a specialist that focuses on each item. So my hat goes out to anyone and everyone working in, especially these small rural health departments, because sometimes there may be one or two people doing everything for the county environmental health wise.
Yeah, and it's really hard to be a specialist in so many areas that get complex. So you were there, the primary focus on food. Then you went and got industry experience, I believe, after that, right? Talk a little bit about where you went next and what you did on the industry side, because it's a lot. There's a handful of folks in departments around the country that it's not common. They have the regulatory experience and they have the industry experience. They always say it made them a better regulator to have the industry side. So talk about the next step, which was completely outside of the regulatory environment on the government side.
Absolutely. Well, as many folks know, there's not a lot of places to go, especially in small health departments and in government. And I wanted to really get a breath of experience. So whenever I left Greene County, I went to Savor Safe Food, which did consulting for a variety of things. And it was whether it was inspections in facilities that companies had paid for, or, addressing issues or searching out gap analysis for areas where they may have food safety blind spots, everything from that to expert testimony. And that work was continued under Matrix Sciences as well. And it just really opened up a whole world, because it was great to be able to come in with the team and talk very candidly without them being afraid of being penalized by a regulator. They were able to share with me all the problems and what they struggled with. And so it really gave a lot of insight as to not only the problems faced, but the tremendous amount of effort, work, and money put into by companies to make sure that their products are safe and that they're doing everything they need to keep the products to be quality products and safe food products.
That's interesting. So is there, do you think, a common misperception for people that don't have industry experience, that they kind of can fall into the thought pattern that industry, it's almost adversarial, and industry needs to be watched very carefully, and did that, it sounds like that opened your eyes that no, actually they have the same interest ultimately, which is not killing or making their customers sick. And is it not well known enough the amount of money that a lot of especially the big chains and organizations do spend to try to do a good job?
Yes, absolutely. There are billions of dollars spent in just trying to keep food safe. And it really was eye-opening, because again, they're asking you, or in my role, came in to be their partner and to say, here's some maybe spots that you haven't thought about. And this is completely farm to fork. So whether it's manufacturing, for example, going out and evaluating the fields to make sure the produce is being grown and collected the way that it's expected by the organization, to back at the end user. Sometimes people forget that if they see one bad instance, especially at a large chain, that chain doesn't care. But there's a lot of ways along the continuum where things can fall apart. Generally, most large companies have really robust food safety plans, but it's more a matter of the local establishment maybe not following what was already created for them.
What is the other thoughts that you have on industry, having been there, working on both sides? Is there things that come top of mind to you that could help industry and regulators actually work more closely together, collaborate better, maybe have a slightly less adversarial relationship? To a degree, I know it's baked in because you do have a regulatory job, but what, from a future collaboration and partnership kind of standpoint, did you pick up by taking the tour through the industry side?
I don't think my role has ever really truly been adversarial. One of the things is, I learned so much from the people that actually I was evaluating, inspecting, and working with. You have to understand that food is our culture. Food represents every major milestone that we have. It's love, it's happiness, it's how we share in sadness. So food covers everything. And so one of the things was learning from the chefs who have spent their lives dedicating to learning their craft. A lot of things are up and coming, they're innovative, they make new plans and processes. And I think that key is asking with curiosity, true curiosity, and listening to how they explain it. Most are very happy to explain to you what the process is for the food product if you don't know it. And it's okay to be like, hey, I've never seen this process before. Can you explain it to me? And so it goes both ways. That respect and education can, and needs to go both ways, so that then as they explain this to you, you can talk to them about potential areas about, hey, have you thought about this, or some additional considerations. It's only through that true listening and sharing can we really get to know where our blind spots are.
Yeah, it's true. And we actually are working on, we don't have the exact scheduled date on it yet, but looking forward to, we're actually going to have a industry panel on a episode of the podcast coming up from a couple of the big chains, and let them also speak for themselves about the challenges they face and what they'd like to see more from a department, and maybe where things aren't working so well. So really looking forward to that coming up. So how long were you there at the Savor Safe Foods? And then what led you to decide that it was time to go back over to the government agency, the regulatory side of the equation?
Yeah, so I was at Savor Safe Food and Matrix Sciences for around 2 years during that time. And I came back to regulatory during 2020. As you know, a lot of these roles don't open up very often, so you don't always get to choose when you're jumping into them.
And boy, you came at an interesting time for getting back into it.
Yeah, it was certainly a very challenging time to jump back into public health, given all the challenges that were going on. But at the same time, I think that's where I was truly needed at that point. So I really enjoyed all the experiences I've had, whether they was with green, whether they was out in industry and learning in that capacity, or coming back and even just trying to help restaurateurs, operators, and the general public navigate through the pandemic.
Yeah, it's something that especially the people in public health are just not going to forget for the rest of their lives. Hopefully we never have something like that again, but it was wild. HS had agencies where directors had police posted outside their house for protection because they were getting death threats and things. Just a horrible, horrible time. So you're director now. I've asked a lot of directors this, not in this environment and format, but just in private conversation. You started obviously in Greene County, not a director. What was the biggest surprise, shock, however you want to characterize it for you? The difference between being an inspector or a supervisor and then the whole circus, the whole shooting match is your job and responsibility. What was that like, shifting into that, especially in a larger county in a metro area? And what's that experience been like for you?
It's definitely different, and it's more of a people management and working for collaboration and working with, our county and city partners and whatnot. I would say there's a lot of times I actively really miss being a field inspector, because I just really love that engagement and interacting with my operators. And so I will say probably the biggest thing that I miss about being an inspector is I really did feel valued every day, that I was contributing something amazing. And not that I'm not at this point, but you seem more tangible. Whether someone doesn't understand something, maybe it's making up a sandy bucket, but doing it together and them learning and understanding, that really makes a difference. Now I'm more focused on everyone and how their needs are affected. So that's where the creation of food safety manuals in different languages and things like that came out. Both roles are very helpful, but you don't get that instant gratification you do as an inspector.
Yeah, and the politics is a lot more treacherous to deal with, obviously, too, at that level. And so circle back really quickly, and then we'll get into some data and some things that you're really passionate about. But back to something you said about you worked a second job because the pay not top notch, or like you could with that degree get in the private sector. And your story is also, though, like so many others, you didn't target this as your career. It wasn't on your radar. You didn't even know that it existed up until you found it, but you stuck with it. And so probably a two-parter here to a degree, rambling through it a little bit. But what keeps you there? What has kept you there when, obviously you could do better, especially earlier in your career, other places? And is what you alluded to with, pay and also the obscurity, which has become a common theme here on this podcast, is the obscurity that they labor in. Is that a growing problem for the future in terms of recruitment? Obviously, people age and retire, and you need the next generation to come in. Do you see a potential challenge looming there? And what can be done to break that logjam, make things more visible, and make sure we get a new generation of leaders when the current generation, yours and mine, are time to retire?
Yeah, I think that, it's really imperative that we focus before students have went to college, because by the time they've completed college, a lot of times they already have a pretty set idea as to what they're going to do, and they're less malleable. If we get to them in high school, we can inform them, give them internships, and work with them. Now, given the funding issues, it's really hard to do that, and we can't offer paid internships. But sometimes we can have you come on and do a summer project or something like that. Funding is a tremendous issue, as well as pay rates, just across the nation, because often folks have to rely on student loans and whatnot to be able to get their education. So whenever they come out and start working, whether it's just barely over what folks are getting at restaurants or outside, they have a hard time debating, like, should I actually go for this, knowing that I'm pretty capped about what I can make? Because oftentimes government can't really negotiate. You may be the best person and best candidate, but they just can't. There's a set amount of money they can pay, and that's all you're ever going to get. So there has to be innovative ideas for a lot of folks, especially when they're first starting out, when you're making the lowest of pretty much everybody, that you have to be able to sustain your family, your responsibilities while doing that. So I think that's going to be a continued challenge of, people going maybe a couple $100,000 in debt to get a job that pays maybe $30,000 or $40,000 a year. And so trying to bring people in is really tough. And one of the big elements is people do this because they care. They want to really make a difference. And I think the people that stay, including myself, despite opportunities to make a lot more, is knowing that we are protecting our communities. And environmental health is true equity, because everyone breathes the air, everyone drinks the water, all these things. If you really want to make a difference, do environmental health, because that's something that affects all of us.
Hi, I'm Cameron Garrison. You've been watching the Beyond Data Management podcast powered by HS GovTech. If you don't mind and are enjoying the content, please take a moment to like and subscribe. Thank you so much for your support. Now back to the video. It's so true. And it is. It has to be passion and a desire to serve, because it's definitely not the money. It's really clever, because you're right. I think it's getting more so as time goes on, that people a lot of times by their junior high school have kind of set themselves on a trajectory. So I assume that's things like participating in local high school job fairs or finding other creative ways to get exposure to these young folks in their formative years, and when they're actually open-minded to what they might want to fall in love with and do.
Yes, absolutely. And I think we need to find a way, I guess, to make it cool. I don't know if anybody out there can make a nice jingle or something. Maybe we have a great motto, or, this isn't the flashiest job around. And, when you're starting out, it may feel like, I just remember seeing the look of dread whenever I first started a facility. And, it's not like, oh, hey, come and help us at the get-go. If you're new and they don't know you, and I did some pretty rough things when I was starting out. I didn't know how to approach the situation particularly well. So, they look at you and you have a look of dread in your eyes, and they have a look of dread in their eyes. And so, it's not the easiest. And I would say most people come in and decide whether they want to stay in it within the first 6 months.
Wow. So it's a very short window and shelf life of when it's going to set in concrete pretty quickly, it sounds like, of what their impression of it is.
Yes, it's very easy if you're not taught how to approach, conflict and bring up difficult issues, that you can feel, absolutely hated. And that when people see you coming, that you're the most dreaded person in town, especially if you work in a small area. When people are calling ahead and saying, "Psst, psst, psst, hey, she's over here," that doesn't bode well. But fortunately, if you invest in building great relationships, then you will come to the other end of things where people meet you on the street and say, "Hey, can you stop by when you're done with this one?"
That's
And
got to
so
be
you can turn that
fulfilling.
around.
That's got to be
Absolutely.
fulfilling. And so, does it mean there's a special emphasis? And didn't intend to really talk about this, so I'll wrap it quickly here, I promise. But conflict resolution and just the bedside manner of people management is probably then super crucial, especially in those early days where you are treated as a foe. If you don't know how to handle confrontational or stressful situations, it's tough, isn't it?
It's definitely challenging. And I think that more than any of the things that, as far as like technical ability, I think that often means less than the ability to talk to people and relate to people, be able to show respect going both directions. Because there's this whole idea of, okay, you're supposed to go in there and take charge and tell them what to do. And that's very common in new folks as they're trying to figure out, what is my role in this and how do I engage? But you can help that in your departments if you work with them, more so focusing on how to have those conversations in a productive yet respectful manner.
Yeah, and you've talked about money being fixed and what it is, and more challenging than ever. Quickly, because this is something I think people around water coolers or virtual water coolers now talk about a lot. I know I get asked a lot around the country. Are you seeing any fallout from the turmoil at the federal level and cuts, rumors of cuts? Well, it was a cut. We're taking it back. Is it affecting you at the local level much yet? And what are you thinking? I know you don't have a crystal ball, but looking forward as to what some of the risks or hopefulness is as hopefully we get through and settle down through all of this.
It is definitely a tumultuous and scary time. We ourselves have went through layoffs, as have a lot of the other health departments that I'm aware of. And what's scary for us is that means that jobs just don't get done, or they don't get done to the ability or level we would like to do them. So the hope is that over time, people can see the value of environmental health. The challenge being is that when things are working as they're supposed to, you don't hear about us.
Yep.
And so, yeah, there's not people dying of mosquito-borne diseases or, bad drinking water, things like that. You don't hear us until there's a problem.
Yeah, it's true. And so you all have actually laid folks off. That's a tough thing, right? Because as we talked about, everybody wears a lot of hats in environmental health departments. So by definition, there's a risk that something that's important can't be done or can't be done as thoroughly as you basically said just a second ago.
Absolutely. We never have extra people to begin with, but in order to counteract these things, we're putting a lot of emphasis on QI and efficiencies, and that includes jumping into data systems. And even our most reticent of technology adopters understand how critical it is for us to be able to modernize our data systems to allow, whether it's automation of permitting, where the customer doesn't have to drive downtown, pay for parking, spend, 2 or 3 hours just trying to get their work done. They can go online, pay for what they need to, they can submit their documents, we can get them. And you have to realize the cost of each piece of paper that goes through everyone's hands and how much that costs over time
It's so
versus
smart.
automation.
It's so smart. Like doing it manually, the cost is hidden a lot of times, right? Because you don't get an invoice that's separate; it's baked into your payroll and things. And that you transition better than I did to really a key topic you're very passionate about, which is data, the standardization of it, the modernization of it, and having it in, for lack of a better term, a open source type of shareable environment so that the broader community can actually learn from that data. Talk about your passion for that, and then that'll lead us to, and we've got a couple of graphics, a couple of specifics after we talk about it more generally, where you're not just talking about this, you're actually out there doing things, and some very interesting analysis that I promise we'll get into as well. But talk about your passion for data and what your vision of that means, and what you'd like to see in a perfect world.
Absolutely. So we as health departments, I feel like have largely just, broke the edge of the water of what we can do with data modernization, because we need to have data systems that we can collect our data and reconcile it in a meaningful way and be able to draw from it. In order for us to use or develop evidence-based practices, we have to have correct data to be able to inform that. But the problem being is, how do we collect it? How do we store it? And how do we retrieve it for analysis? And so that would allow us, the more we invest in that infrastructure, then we can unify fragmented data to say, what does the whole picture look like? Because a lot of facilities are inspected by not just the health department, but say the fire department, code officials, many different folks. And so my dream at the end of the world is that we're able to unify not only health department data, but with other entities, so that we can have a more holistic picture of each facility and be able to address their issues more effectively. Using these data systems, it allows us to standardize. A lot of programs are still writing on paper, whether it's an inspection or things like that. And it dies in the paper because there's not manpower usually to convert that to a scanned file, and you can't search it once you do. And so by adopting these data systems, it really helps out with real-time monitoring. We can create dashboards so that the public can see, hey, is there a lot of mosquitoes in this area, or what's happening? How many inspections have been done in my city? Whatever that stuff looks like, we can do that real-time monitoring, as well as make things accessible to folks that normally wouldn't have access to that data. It's important that we share our data in open source, and that leads to one of the research projects that I did. But the more we do that and the more we share data, we can really glean from those results.
And I think, the AI is going to really make this, I think, even more urgent, because, it's interesting. If you asked an inspector off the top of their head, hey, if you go down to that restaurant around the corner, whether it's a Waffle House or a Chinese restaurant, what are the most likely factors going to be? And they may get it right for that facility. Inspectors do know their facilities in a lot of cases, and they're in there a good bit, especially if they're not doing what they should be doing. But that's not taking into account any data other than the universe of data related to that establishment, right? Whereas AI can compare a facility to all of its peers. It can do that locally, state, nationally, and then actually, based on broader historical data, make suggestions to an inspector. Hey, before you leave, make sure that you focus on these 3 or 4 items. Did I butcher a potential explanation or use case for AI, or what do you see as the urgency to data improvement because of the capabilities AI is going to be bringing in, like starting now?
Now, I think there's definitely a lot of potential, and to echo some of the things that you were saying, considering that a lot of our folks are working, above and beyond and doing more than their share of things, it can be really helpful also to even limit, the amount of information they're trying to process. For example, if I went to ABC facility, it would be great as I start my inspection that there is some kind of alert, and that can historically go back for that facility as well to say, hey, these are typical problem areas. And unfortunately, when you see hundreds of facilities, sometimes that it kind of all blends together. So it can be a reminder, oh, remember last time this was an issue, or this is a long-term issue, as well as like those you said, it can compare against local and state and nation, different entities of comparable data to be able to say, hey, these tend to be more problematic. I think we're going to need to be able to follow on AI to be able to determine also, where do we concentrate our very, very limited resources? If we have an area that's functioning very well, is it prudent to disperse the same resources across all, or do we focus on the areas that really struggle?
So true, and such a great point. It's something that Colorado's done really well. I think hopefully at some point somebody from that program will actually be here, hopefully at some point, to talk about it. But they went through algorithmically and would reduce through the same treatment to everybody, but based on marking history over a certain period of time and a couple of other factors, risk, of course. They were, in some cases, taking an establishment to an every 2-year inspection cycle if they proved they could be trusted with that. So to your point about limited resources, let's put them where they matter most, that allowed them to be in some places every 6-7 weeks because those were a much more imminent, I won't say threat, but a potential threat that they needed to spend more time with. Do you think something along those lines is a model that the rest of the country is going to have to ultimately reckon with because of resources?
I think that would be super helpful. And one of the things as health departments, we got to be able to share if one of us can develop something to be able to share it with others, because there's no need to recreate the wheel for these things. So if we can have more, consolidated processes and how we do things, it also makes our data more comparable. I think it's really important that we're able to look at that and use actual evidence to direct the work that we do and the decisions that we make. We pull statistics now, but it's all manually pulled. So there's an actual person pulling that and compiling it, which obviously takes a lot of time and effort. So when there's not a lot of staffing, that's the first thing to go.
Yep, that's right. And so do you see, like, what is the thing that prevents, there seems to be sometimes a resistance to borrowing from other agencies. I've heard, literally, it's been said to me before, well, yeah, like, it's pretty cool what they're doing with their data, but that's an LA idea, or that's a Tulsa idea, fill in the city, almost as if because it was thought of or is being done by someone else, that makes it a little suspect to consider adopting it in your agency. Where does that hesitation and sort of trepidation come from?
I think it's just a culture of mistrust and that a very antiquated style of thinking. The thing is, if one candle lights another candle, the first one does not become dimmer. And I think more people are adopting that line of thinking, as we move forward and being able to help each other out. And the more people are able to share their data, interestingly, it can be very hard to get data, especially on inspection results, from health departments and things like that. And that's what leads in one of the projects that I did was statistical analysis of restaurant inspection scores, both before, during, and after the pandemic. I worked with Dr. Nicholas Scott of Apogee Engineering, and we evaluate Austin, Texas's inspection scores. And because they had open source data readily available on their website, and they use a scoring system. Note for others out there, not all states use a scoring system, which is 0 to 100. But if you're looking for, just a rudimentary plan to be able to look and see what's happening, it makes it really easy to be able to look and see about trends. And one of the things we were able to do is take that and evaluate it to validate some things that we thought were true.
It's fascinating work that you did. And Austin, great department there. They are HS Cloud Suite users, and I think they're going to be able to publish additional detail of data soon. So you picked them obviously because they had a larger data set and they were doing scores. That is a problem, right? When you're trying to do analysis and comparison, especially at the big level, is the baseline for the inspections and how the final result is calculated varies so much. Are you a fan of scores? Obviously, having a score makes it easier to do the analysis we're going to be talking about here. But what is again, if you could snap your fingers and make the nation do anything that you wanted in this particular area, where are you right now? A score, a demerit system? What makes sense, especially in the interest of analyzable data?
So, Cameron, that's $1 million question. That's a whole separate podcast discussion.
Yep.
But in essence, it's not really whether I'm so much for or against it. I think there's a lot of parameters that, it could be helpful, it could work, but without the right things, working with you and a process, it can go awry. So again, it's very based on the entity that's using it. And like our state doesn't do that. And sometimes you're prohibited from being able to do that. Now, some states also do like letter grades, which that's really helpful for the public, because one of the things is that the public doesn't really have the ability to discern, even when we publish our inspection reports, say, oh, there's 5 violations. Someone may be enraged because we haven't shut them down, but they don't really understand how to prioritize. Now, that could have been maybe a dumpster lid was left open and things that are still important in the overall scheme and long-term health of the facility and their food safety practices. But, there's a lot more imminent things that maybe the walk-in is down or there's a inadequate cooling process. And so they don't know how to evaluate. Maybe a facility has an inadequate cooling process and a cooler unit was down, they may have 2 violations out of that. But then someone that has 5 violations based on maybe a broken gasket, a broken floor tile, things like that, they can deem the one with those 5 to be more dangerous, so to speak, than the other. And so, one element is trying to help them. That I do think the letter grades or scoring does help people understand a little bit, like, okay, you're at 98, you're probably doing pretty good. It gives them something to think about because, again, it's hard for them to know. And also, I encourage people to think about whether it is a one inspection or a trend. I encourage folks to look at trends because anyone can have a bad day, any facility can have a bad day, but it's more about what we see overall.
That's a great point. A snapshot in time. Look at least several before you form a overly judgmental or a good opinion, for that matter. And you're absolutely right about the letter grades. I think it's because it's a framework everybody can relate to. Of course, of course, you can find downsides in anything. You'll run into people though, because North Carolina had letter grade placards for many years. They've just gone to a score now, but they did have letters and score before. And you had people though who their referential framework was school. And some people are overachievers and an A- makes it a bad day for them. Some people are like, hey, a D passes. And so you would have people that would say, well, it's a C, but when I was in school, mom was thrilled if I could escape with a C. So it can't be that bad. So talk about this thing. And we actually have some slides of your deck we'll pull up. I think, David, we'll start maybe with that slide 2 through 6 range there. From the PowerPoint. So we loaded that up for you in advance. You don't have to speak to it, but we will. So this is across multiple platforms. If you're on YouTube, obviously you get the full video and you'll see what we put on the screen. You'll still get it because Sarah's going to be talking about it here. If you're on the other platforms that are audio only, we will put this on the podcast homepage and make this material available so that you can see it for those of you that are listening in the car on a platform that doesn't have the video support. So talk a little bit about the sort of the scope of the study, like how much data over what period of time were you looking at from Austin, kind of what the focus area was, and ultimately we'll get to findings. But this is super interesting and looking forward to hearing more.
So we started out with, again, the Austin data system. So there we were able to get thousands and thousands of data points where other things were not able to be so consistent. We took those from before COVID through during COVID and then after COVID. And one of the things that we were able to look at and see, even before COVID, we could identify areas that seemed to have a greater need for more assistance in trying to achieve those food safety goals and guidelines and compliance.
How did you drill down to see that in the data? That's super interesting. Super familiar with Austin's data and the data that's available. How did you cut that to be able to make those determinations?
So I am barely the data person. So this is where I had the help as someone working on this. But, essentially we used the inspection scores. The data was structured into matrices based on zip code, and then it was ran through different time periods. And interesting, we could see a strong seasonality as well with inspection results, depending on what time of year it was, but it repeated year after year. At those periods, they tended to go up or down depending on when the inspection was completed.
So there was a seasonality to the pattern of violations or deficiencies?
Yes, you could determine with great accuracy about what would happen likely in the next season because they tended to trend. One of the things often with inspections that we tend to do, they tend to be predictable time. Like if you did them in June this year, they tend to be in June next year. And so there's maybe some confounding factors with that, but depending on when they did the other inspections, we could see that, there were certain periods that were more apt to have larger amounts of violations. Now, is that because of the temperature changes? Is it because of travel season and being busier? Is Thanksgiving harder? There's a lot of different factors, and doing analysis like this and having some kind of mechanism. We used the one that was scored because it was less work intensive, but if we could code correctly, we could do this with any sorts of data, but it's very labor intensive. And so we just wanted to be able to see roughly what does that look like? Can we demonstrate this? And so one of the things that takeaways we got from this was finding out those that struggled before COVID. continued to struggle during and after COVID, but the amount of disparity increased after COVID. So those that were doing great, they still dropped a little bit, but they were still doing great. But those that were doing rather poorly before COVID just really were tanked and struggled during and post COVID. So the disparity between the two scores was even greater after COVID.
After that's fascinating. So what it sounds like you're describing from the data is people that were kind of barely hanging on by their fingernails in this, in the area of running a clean or a in compliance establishment. COVID was just the final blow, and it sent them tumbling. Whereas ones that were in the top quadrant before may have dipped a little bit, but they were more stable, or I don't know what the word for it would be, and it didn't have as deleterious of an impact on them. Is that an accurate representation, that it just wiped out those folks that were barely hanging on to start with?
Yeah, I think that's, it's really an astute observation, because also when we have limited resources, because these can also be tied to specific zip codes. And so it
Yeah. In
appears
fact,
that whether
don't lose that thought,
it's foot
David.
traffic.
If you have that PowerPoint, no, I'm sorry, just the zip codes, the map would make sense, right? Is that the best
Yes.
one? So, David, yep, there we go. There's special distribution of minimum scores. You don't have to speak to it directly, but I just wanted the audience to be able to see this, because I think it illustrates what you're talking about, of how granular you got.
Yeah, so you'll see the numbers on there. So say you see the one in the top left corner, there was one that was 86 and it went down to 70. This is what we observed from before COVID to pre and post COVID. And the great thing is we'll be able to continue analysis on this, because as they continue publishing data, we can see more long term, and that's one of the values of this. But we can also see, the lowest scores, where they're concentrated at. So maybe that, is that foot traffic? What kind of barriers and issues, struggles are there in those areas? When we don't have a lot of money and we have a lot of work to do, it can be helpful to focus our resources on those that are truly struggling the most.
Yeah, this is a fascinating map. Is it accurate? I haven't spent a ton of time studying it too deeply, but it looks like towards the center of the city really took a nosedive peri and post COVID, whereas some of the what look like outline zip codes, while a dip wasn't nearly as severe, but I see a lot of 50s in the center post COVID.
Yes, and that's one of the things that we found. Specific zip codes and areas really, truly did struggle. We could pinpoint which ones that really faced the biggest differences and struggles in that. And that's where it allows us to ask the questions. Is it because people were scared to be around crowds, and those tend to be more populated areas? And what about the most tenured folks? Did they, in those areas, they felt it was too dangerous to work, so they didn't come to work? Or there's lots of things that allows us to think about further. What are the root causes of poor inspection scores? Because if we keep treating just the symptoms, yes, we can have them fix it while we're there. But why do they keep having this issue? And why is this such a struggle? Maybe we do some free food safety education in classes in those areas. Maybe we locate them in some of the local retailers. That's one of the things we've done before, is finding, hey, this is the area where there seems to be a lot of challenges. Let's get one of the places to host us, and we'll do a free food safety class. And then, is it barriers? Can you not quit work long enough to take the class? Or it just gives us an opportunity to really think about root cause and see, why is it in these areas versus the others?
It is really fascinating. And with your okay, we'll post the presentation that you did at a conference there in your home state of Ohio on it. And we'll make sure, so that'll be on the podcast webpage. We'll also post a link to it in the description on all the platforms of this episode. One of the things that stuck, what were the findings? Because what stuck out to me is one of them was recommendations include enhancing education on food safety to improve compliance in a future health crisis. Is it easier said than done in that sentence? What does that look like? Because obviously there's a lot of turnover in the restaurant business, and it's tough. It's a tough industry. How do you go about connecting to educate from a department level? What are the tools and mechanisms that you think are worth a try?
I think it just allows us also before these things happen to be able to plan, knowing, where the challenges are. We can create individualized things for those in certain areas. And I think just being aware that it's not that the others aren't important and we shouldn't be in every facility, but it's saying if we have another disaster, these are the folks we know that will be struggling the most. And so what can we do? What can we prepare beforehand? Can we help them with an emergency manual? Can we provide things then what to do in a power outage, what to do in these things that they may not understand or during the situations? And it's more about being able to target those limited resources that we have, because inevitably there'll be future things that come up. Maybe it won't be as widespread, maybe we won't shut down, but there will be additional things to come from. So how can we prepare them, work with our emergency preparedness teams as well, to be able to make sure that they are as strong and robust as they can be whenever these things begin?
Yep. And I guess, too, it's no different than, so I think law enforcement has had in at least some jurisdictions, especially larger metros, more of a needs-based deployment approach, right? So if they know that there's more issues or problems in a particular precinct, it's going to be staffed higher. Certainly an oversimplification. We're not law enforcement experts, but that is not how environmental health departments have generally stacked their resourcing and their inspector deck historically, really at all, is it?
No, it's not. And this is really a triage-based system that's often used in police, but also the medical world. And so in times of great need and limited resources, what can we do? Historically, we have mandates that says we must be in every facility 2 times per year. They must get 2 standards, 2 critical control points, or whatever your state requires. But it doesn't allow for, oh, this area struggles, so we need to maybe have more. And it takes away a lot of the autonomy when it comes to deciding how much and what to do. But we can take information like this to back and gain support for understanding at times of crisis. We need to be able to dictate, okay, here's where we need to spend our resources versus trying to stick to, no, we give everybody the same all year long, regardless of whether they potentially need it or not.
And that marries back to, it's easier to do that if you have your data normalized and in a very powerful system, right? Because you're able
Yes.
to answer the level 2 and 3 questions that come from the first one that you can calculate for, and that way you're not guessing as much. Is there anything else, just even if it's not a definitive outcome of the analysis that you've done to date, at least a potential trending observation or any other nuggets that you think are interesting that we haven't mentioned that came out of that really impressive analysis of Austin's data?
I just think it opens up the door. And part of the reason for doing that was demonstrating and showing others in a rather simplistic way how we can do just basic research. Because I have a couple different research things. One of the other projects was sponsored by the CDC's SNAP program. And so that was a very expensive and very robust analysis. But we can also do smaller analyses because we have to understand sometimes we need to do something rather than nothing, because we can't always wait to have the right amount of money to do something robust. We can glean information no matter what type of resources we have if we have a robust data system. And so it's relying on that system to help us make decisions based on data so that we can inform what we do next.
100%. And it was impressive work with Austin, and of course, proud. It's just GovTech is the underwriter of this podcast, and Austin is a proud user of that platform, and it's, I think, served well in what you were doing with it there. So we will post all of that, and I would encourage everybody who's listening or watching to definitely go look at that presentation, and we'll put Sarah's contact information in the description of the episode. And I think you'll want to reach out to her probably with some questions as well. You will continue this, right? It sounds like you're going to continue to build on it since you have ongoing access to the data.
Yes, as long as that data is available, we plan to continue to reanalyze it, and so that we can glean further things from it, and hopefully marry it to other projects like the other one, the Certified Food Protection Manager and Inspection Performance research that we were doing with Dr. Allison Howe of The Ohio State University and
Yes.
Dr. Kowalczyk.
And I said, David, if we could, the great David Stiles in the control room, clip one, C1. I actually, now this is embarrassing because this is a picture and you're about to tell it, so I won't steal your thunder, but this was a presentation at the Conference for Food Protection. And I found it really interesting. And I actually, you can see on the picture there, it's a snapshot. I took it on my phone of the summary board of it that was posted on Gator Foam at the Conference for Food Protection. But everybody that has the video feed should see it now. And this was fascinating to me because it looked at the corollary between a certified food safety manager on staff and outcomes. Is that correct? Tell us about it.
Yeah, so what this did is we looked at inspection data retrospectively before Ohio had introduced a requirement to have at least one certified food safety protection manager at each facility. And so we looked at the data before and then after. And so we was able to glean from that. The inspection data can be used to show changes to food safety regulations, and we can monitor how that affects what happens in our facilities, as well as, a hot question is like, well, what about inspector variability? This is a huge thing. We try to standardize, but it's still an issue. Fortunately, from minds smarter than me, they are able to do statistical methods that account for the inspector variation. So we're able to take that part out and see what is left.
So do you mind, I don't want to interrupt your flow, but that is fascinating. How are you doing that? How do you take out because by definition, it's kind of ineffable, that variability. So how did you accomplish that?
Yeah, so that is the brains using GLMM approaches, and that's a whole different podcast as well. So I won't get into the complete weeds of that. Anyone that would like to reach out via my email or through LinkedIn, I'm happy to discuss more and get more in the weeds with that. But, you're able to do that and also take out for other variations. And that's why we partnered with academic institutions to be able to have the best and brightest minds to be able to make sure we're not seeing blind spots in that data. And what came from that is we see the increased investment in infrastructure through the data modernization and data systems. We're able to collect and disseminate information, which allows us to do a representative analysis. And then we can use that to increase foodborne, disease prevention activities at local health departments. And that data was gleaned was able to pull from the state of Ohio based on the organizations that used HealthSpace retrospectively, both before and after the introduction of the requirement for CFPMs.
Yeah, so you pull it from a database from HS. What were the findings? So it sounds like you had extra infrastructure investment that went in, which is really interesting. I wouldn't have guessed that one. What was the impact once that rule went into effect on outcomes and the overall general performance of facilities once they came into compliance with the new rule?
We did find incredible linkages to the number of critical violations found of facilities who had a CPFM on site. And it's even further exemplified. Some facilities require all their manager, it's more than one. One is the bare minimum. And so the more that they had, the more that they had them on site, we saw better inspection results. So things like that allows us to take, okay, so why in areas that it didn't improve, why was that? And that's where we can look into, is there cultural language barriers? Or what other things are preventing that from being as effective as possible?
Yep.
And so I'll just add on to that, NACHO published information about our food safety manuals, which are created in a variety of languages. And I think that has also helped as well.
Cameron Garrison here. We'll get you right back to the video in a minute on the Beyond Data Management channel. Want to take a moment to thank the sponsor and underwriter of the entire channel on all platforms, HS GovTech, the creators of HS Cloud Suite, which is the preeminent platform for data management for over 1,000 health departments around the country, whether it's permits, inspections, complaints, or disclosure online to citizens and the public. It's all in HS Cloud Suite, and it's more affordable than you might think. Again, special thanks to HS GovTech for sponsoring the Beyond Data Management podcast, allowing us to bring the stories of environmental health to all of you in the community. Now back to the video. Yes, that especially, and you're in a larger metro area department. This is a real and growing issue, the language barrier. I think this is another area where AI is going to be really helpful because it will allow. So, for example, even basic day to day things, a project that I've been involved with is AI virtual agents, which have gotten to the point they're almost indistinguishable from a human, but you can text with them as well for things like foodborne illness complaint or reporting intake. Because you have an AI agent that can speak 39 languages, infinitely scalable, 24/7, 365. Do you see a role for technology in some of the more difficult to reach places, especially around things like language barrier and where it's really hard to get a breakthrough and be heard?
Definitely. I think it'll be also very necessary because it was very expensive. We created our own, it was a cross in between a level one and a level two food safety manual. And so we created our own with just the very basics, but it was very costly for us to translate all of those into different languages. And it's not that there wasn't any out there, but oftentimes we didn't have a companion English piece. So while we looked at the pictures and maybe could glean what it was about, we didn't really know. And we have to understand that that's how those that maybe English as a second language look at our handouts as well. I think it's talking about the sink, but I really don't know what it's saying.
Yeah, and it's just been a persistent problem, and I think as the culture gets more diverse, it's going to continue to grow in its scale. So, in retrospect, it's pretty definitive, you think, to say that the rule requiring a certified food safety manager had a definitive impact and was in the interest, in hindsight, of public health and safety.
I do, and I would like to add in for any of those who may be listening that have the power to do this. I think if at some point we could automatically print or translate, send our inspection reports in other languages, that I think that would be really helpful for those that are receiving them to be able to see it in their own language. And to track back to the AI bit, it makes it affordable and something that we can actually do on the daily basis.
Yeah, and as we've said on multiple episodes, I will take a quick side trail on it, though. Here, it's not a commercial for our sponsor and underwriter of it, but the multiple languages is a feature that I know is in HS Cloud Suite and is really starting to get traction. Because you're right, if you have someone whose primary language is not English and you're trying to give them information on proper cooling or whatever, if they can't read and understand it, you might as well have not given them anything.
I think that's super critical. And just remembering, those from other countries, they also share our love of food and they want to share their culture with us. And so I can tell you, we had a fantastic response, and some of our folks were so happy to receive these. And we immediately saw improvements in those facilities just when the inspector was going in. And one of them specifically was like, I was so excited. And she shared it and taught her team based on that. And so I just think we have to be able to look at these things that it really is an issue. And for us to get better performance and collaboration with those that don't speak English as a first language, I think that's going to be imperative and super helpful for any organization that can do that.
Yeah, well said. It was great analysis that presented, and the grad student from The Ohio State did a fantastic job presenting it at the Conference for Food Protection. Quickly on that, and the CFP, as it's referred to, in fact, the episode after yours, it would actually be David McSwain, the executive director of CFP. But maybe talk for a minute about that, the critical role that the Conference for Food Protection plays. I think there's actually a lot of lack of understanding or only vague understanding in a lot of agencies, especially at the inspector level, about how the actual food code that they use to inspect comes into being and evolves over time. Anything that you'd like to, feel free to talk about a little bit about CFP, its value, and what you've found, enjoyment and satisfaction in being involved in it from.
Yes, absolutely. And this is something, again, like you said, most people have no idea what this is about. And I feel like it's really a Congress rather than a conference
It
because there's
is.
certainly no rest involved in the conference, but a lot of people working together very hard. And that includes, so there's academia, there's industry, consumer groups, as well as regulatory groups. And it's a very organized way to take things from across the country, concerns and issues that people bring, and be able to deliberate them together in a respectful way, to be able to offer recommendations to the FDA to inform the latest version of the FDA food code. Because that's where our codes, like here in Ohio, those are adopted and those become our laws, our food codes. But oftentimes as a new inspector, you come on and you're handed this book and these are the rules and you just do them and enforce them. But there's more to it in understanding. The FDA also has a great annex that is helpful as a new inspector to be able to understand, okay, so why do we make you do these things? And to be able to explain to folks about why, because I feel like you're much more successful in getting a behavior change if they understand why you're asking them to do it, but rather than, oh, she's just coming to make my day more difficult. And we have to make things easy for people to do the right thing. And so that informs that to be able to understand what's important that they do this. So how can we change the process so that it's easier for them to do?
Yeah. How long have you been involved as a delegate and with the organization? And you're right, it is a Congress, right? It actually it goes through committee and then goes to a floor vote. But how long have you been involved now? How many cycles?
So I'm on my first official cycle on the executive board, and I had completed a vacant role for the Mid-Atlantic in the previous role. So I'm about 3 years into my executive board role. And keep in mind, no one forces you to jump all the way on board at first. It's okay. You can come and look around and listen and watch and just take it all in. You can be a part of a committee. No one forces you to know all the answers. And I'm saying this to anyone who may be interested in that. Again, I'm super happy to talk about it more in depth, but I would say it's about $100 every 2 years, which is less than most of our coffee habits every month. So again, it really provides a lot of impact because Dr. McSwain shares, research and things that are happening as well as job postings within industry or without, in regulatory. It's really just an open place for people to be able to talk with others respectfully. And again, it's another venue where I've learned so much because we all have a seat at that table and can raise our concerns. At the end of the day, people walk away and may still have dinner together or all those things because it's not adversarial. And that collaboration is something we need to continue at the local level.
It can be intense, right? I've seen some passionate debates at them, but you're right. Always respectful and within the bounds. And I'm really glad that you said what you said about you don't have to commit and sign a big commitment and go. $100 is, especially as things like this go, super cheap, especially every 2 years. I would encourage anybody who's in an agency or in environmental health, at least go and observe. When I went to the first one a few years ago, it was just a great experience. I learned so much. Things that I thought I already knew, I got a much better understanding of. So yes, when it comes up again, and I believe it, so it just happened in Denver, so it'll be 2027. Definitely sign up, definitely attend it, even if you don't stick with it or become active in the organization. So, Sarah, if you'll indulge us, we're going to do quickly, and we're going to wrap up, obviously, in a second with the fun parts for sure for professionals that have been in the field before and run teams that have been in the field. But if it's all right with you, let's chat about a couple of viewer feedback and comments. First of all, I just want to thank everybody so much for the way the show's been received so far. It is here just to create community and let you hear from leaders and people that haven't been heard from enough. In the first 5 weeks since it was officially launched, we've passed through 125,000 viewers / listeners. So really, really appreciate that. And what I really appreciate is all the feedback and comments we get. So we're going to try a new segment here where we actually do just a small handful of some of the viewer letters and feedback. I say letters, but no one licks an envelope or a stamp anymore. I think stamps self-stick now. But this is all virtual. Also, if I can just shamelessly plug here, If you all don't mind, if you are enjoying the content, please subscribe, whichever platform or channel you're listening on. I'm learning, and been in tech for 25 years on the EH side, but the algorithms for these platforms, it's a whole different thing. And what I'm learning is that the feedback, the like, the subscribe, etc., as corny and cliche as that sounds, actually helps them put that in front of more people that are like you and are in the industry. At any rate, enough with the asking you to do stuff, folks. Let's read a couple of them. The first one, we actually got one from the UK. And so I'm going to apologize in advance for those of you on the video feed. I'm going to just read. For those of you that are listening, I just told on myself. But the first one was from the UK. And a verified food safety, registered environmental health sanitarian in the UK. And this was in response to episode 8. We had Chirag Bhatt on, and we were talking about he was talking about a couple of war stories he had when he was in the city of Houston about donations from associations like the Restaurant Association to the mayor's office led them to try to kill the public disclosure site. So Inspector in the UK says we have scores in our system here. We have scores on the doors. It's a 0 to 5 rating, and they stick it on the window. And they went on to say, it's really strange that there isn't a national body with governing oversight of health inspections in the United States like we have here with the FSA, which is the Food Standards Agency in the UK. And went on to say, you would think that public health information would be, well, public and easy to access and uniformly, regulated. Well, first of all, thanks for watching in the UK. That's fun to hear from you. As your famous prime minister during World War II, Churchill, said, you can count on Americans to do the right thing after they've tried everything else first. So be patient with us, cousins across the pond. And Sarah, on that one, I don't think there's anytime soon, politically or otherwise, going to be a change to more of a central standardization. Or am I missing something? Probably just not in the cards in the U.S., is it?
I don't know that it'll ever get there or be to that point. We do have some oversight, but that's committed by usually the agencies directly above us. So for us, it's the Ohio Department of Agriculture and Ohio Department of Health. But so there's some of that, but again, not as one unified species.
Yeah. And one more on that episode about public disclosure from an industrial specialist, manufactured food, et cetera, says that in his opinion, that some of the frustration and pushback for posting inspections online has probably been aggravated by Yelp and the way that Yelp has kind of homogenized and put their own kind of version or summary of inspections out there. I don't know, but it's certainly interesting feedback. Next couple, this one I thought was funny. So when Steve Mandernach came on episode 7 a couple of weeks ago, he really wanted to talk about the failure of regulation from a health perspective of cannabis and the patchwork that we had there of different rules and laws. And Louis Martinez wrote in and said, and definitely adding just some levity to it, says, well, in my opinion, the best way to slow down bad operators of cannabis shops is to have a new environmental health regulatory policy that 2 eateries, such as Dunkin' Donuts, Burger King, Wendy's, or Krispy Kreme, must be opened in the vicinity of where the shop is. And that way, unruly stoners will want to eat and will go to where cops are already hanging out. Louis, thank you. Do you have any comment on cannabis? Because Steve did talk about that. I think you just legalized recently fully in Ohio, didn't you? Or is it still just medical?
Yes, we did. But keep in mind that it is still not legal as far as a federal rule. And most employers still have the ability to say whether or not they permit that. So even though it may be legalized in Ohio, that there's still a lot of challenge when it comes to that and whether it affects you in your job. One of the things we're seeing is there's sometimes incidental poisonings and things because they're being added to things that children would often, whether it's candies or brownies or things like that. And so we need to figure out, I guess, better ways to protect and make sure that children aren't getting a hold of these, because then there's that accidental ingestion of too much.
Yes, and there's also, as Steve talked about, and this is the last one from C. Marsh, came to us through Reddit, and exactly to what Sarah was just saying. She said, I moved from food inspections over to the cannabis regulation program in my health department. Specifically, I'm focused on edible production. I love it. Assume the job, not the edibles, but hey, both do. It's legal in her state. But that's a good thing. I like the challenge, although it is hard. And this was what I thought was interesting. She went on to say, food safety knowledge in this industry, even from the regulators, is severely lacking. A lot of regulators are so concerned with the potency, which is very important, that they overlook the food safety portion. Steve is so right about the lack of research. It's incredibly difficult to try to extrapolate bits and pieces from little bits of data that are out there. And in many cases, it wasn't good research to start with. Do you see also, Sarah, a concern about just a lack of food industry knowledge by operators that are opening up in this space? Is that something you're hearing or even seeing?
Yeah, there's a whole lot of talk and chatter. The challenge is we don't know what we don't know at this point. I mean, I think we have our traditional things, but how does it change whenever we merge it with things like marijuana edibles or stuff like that? So I just think there's a lot of talk and discussion, but we have a long way to go, because most people that I know really just don't have a whole command of all the facets. I feel like that's another specialization, outside of whether it's food, people to specialize in cannabis and marry that to food safety, because again, that's a whole lot of stuff that I don't think we really know too much about.
That's so true, but in typical fashion, and what you all have to deal with every day. It happened during COVID. Oh, a new mask mandate from an executive order give it to environmental health. They have people in there already. And like, you get a lot of things like that thrown at you, don't you?
Yes, there's always a lot of different things that come at us. And unfortunately, a lot of these are unfunded. And so what that yields is it stresses more time to also focus on the things that really are high priority. But also, again, we can't keep track of it. Again, we can't purchase a data system to add it to keep track of it. So things that we're being added to regulate, we need also additional support to be able to regulate it in an effective manner, because we don't want to give people a false sense of security.
So true. And thank you to everybody who did write in and comment. Please keep the comments coming. We'll plan through multiple episodes to share some of your feedback and bounce it off whoever our guest is that day. And you can reach us many ways. A couple of those came through Reddit, where there's a lot of folks in the environmental health subreddit that watch and follow there. But you can comment on whatever platform you're in. All of them are read and will be put into the pile for participation in the show. But you can also email us. If you want to email us directly, you can email us up there on the screen, as you can see, beyond@hscloudsuite.com, beyond@hscloudsuite.com. Thank you all so much. Keep the good comments and the fun stuff coming. So, Sarah, as we sort of pivot to the home stretch here, it's always fun. One of the things we get so much feedback on from listeners is they always ask the next guest the same thing. You've been in environmental health and in multiple different roles. Inspectors see the darndest things, don't they? So I think you've got a couple stories prepared for us. So let's do the war stories here as we head towards the conclusion. It could be crazy, outrageous, sad, funny. It's totally your canvas to paint on. But what are some things that stick out in your memory on that side of the ledger from your time in EH?
Oh, there's so many things. And again, if you never want a dull moment and you would like every day to be different, please come to public health and especially environmental health. So in my time, one of the big things was my folks are innovative. And I talk about my operators. And one of those things happens to be, I've seen cabbage being, decompressed from the water with various things. Sometimes it's you throw a couple garbage cans on it, press it down. Sometimes you just stand in it like it's grapes. But the biggest thing with that was one time I was doing an inspection and, it's, again, you just hear like this roar, and you're like, we're curious people. That's what gets us in this job, and it's walking out back. And, interestingly, they had this idea that they would put the shredded cabbage into garbage bags, which, mind you, don't do that. They have pesticides in there. But they threw it in there, and then they put it between two sheets of plywood and was driving the car over to squish the water out.
Come on. They were backing back and forth over the cabbage in a hefty bag.
Yes, it was a very fast way to get the water out so they can continue prepping their products. But it was just, they pressed it between the plywood and they was going to smash the water out, then take it in and use it to make their product. And so, yeah, again, it's never a dull moment. And if you hear or see things, that curiosity also leads me to all kind of different things.
Well, so by the time you went into the back parking lot, because a car was involved, that's a first, by the way. That's really funny. What'd you do after you figured out how to put your jaw back closed?
Well, usually my lead in is asking folks, so can you tell me about what's happening here? And can you explain, how does this help? And, asking, with some curiosity to figure out the thought process. Exactly. And coming across of how they derived that this was the way to go, because it's just as important to interrupt that thought process as it is to, hey, stop doing that. But then they may do the same thing with something else if you isolate it to this. So again, in innovation, they thought, we put it in a bag. It was a clean bag, right? And
that's something.
It didn't touch the tire. It didn't touch the tires because it's between plywood. And so it's just understanding how people reason and talking through, well, okay, here we cannot do this. And
so
here's why.
They thought they were taking safety into account, I guess, right? They're like, layer of plastic, 2 layers of plywood should be safe.
You got to realize that most everybody learns food safety from their grandma or their mom or whoever they live with growing up. And until someone tells them, no, this is not right, you have to do something different. That could be an educator, a manager, or whatnot. But if those don't enter in, people continue to do things the way that they were often taught to do it. So that's important to keep in mind when people are responding aggressively to things that you are saying. How could you possibly be right? Because you're telling them, no, grandma was wrong or mom was wrong. And so that's something to take into account and understanding why they do those things, but also explaining we can't do this because XYZ.
That's a great point. So I don't know if you can top that one. That's amazing. What other ones made your list that came to mind?
So also during time, there was a viral video of an employee taking a bath in the 3-compartment sink. This is when we first got videos and didn't know what to do with them. So we videoed all things apparently. And
wait a minute. This was a video the inspector took. This wasn't like taken by a customer or something and put online?
No, it was taken by someone else that was there, was taking a video of the person taking the bath in the 3-compartment sink. And of course, that always comes back around to, your health department, because we always know, because we get lots of communications no matter what. And so, there's that, but it segues into, I've seen people doing a lot of stuff that we should not do in food service. I walked into somebody peeing in the drain. They're smoking.
You have? Okay, so
yes.
The reason that just made me jump is one of my all-time favorites. It's actually from Ohio. An actual inspection was written up. Inspector observed cook open fly and urinate in floor drain under cook station, and it was at the Burger King at the Cleveland airport. And it was some time ago, so remember, snapshot in time. Lightning struck more than once. Now this peeing in the drain thing, I'm wondering if it was more of a fad or a trend. What was, how did you walk into, what'd you walk into? Well, we know what you walked into. What'd you do?
Well, like all things, I try to be respectful, but also I think I'm also a ninja, because I can walk through and unseen. People just don't even see me. And so I just walk in and catch them doing, they can be spitting into the drain or into various things, just all kinds of stuff. And apparently this is rather common. I didn't expect that this would be, but again, sometimes you have to understand people's line of thinking, I guess. They say, oh, well, they told me I was taking too many breaks, so I don't take breaks now. I just go in here. And, okay, so no, That's not how we do things. Same thing with, there'll be smoking. I've walked in on smoking. And again, because a lot of times, one of the interesting things is I'm always aghast at my ability to walk in a facility and nobody says, hey, who are you? What are you doing? Why are you poking around in there? It's always interesting, when, especially if I'm new to that area. And usually there's a discussion, but sometimes if people ignore you for long enough, you just go in and you're like, hey, what's going on? And then you see all these very interesting things. And, it's important for us to be curious and look in all the things. And that has taken me into one of my other elements is talking about, there was a backroom slaughterhouse because I was like, hey, where's that door go to?
Of live animal, of live animal, like slaughterhouse.
Yes, they would just go, they really took fresh food to a new level. And, they were just doing, they had like slaughterhouse supplies, but they had bought like an extra section off of their restaurant and they were using that. But again, it's just asking like, so where's that door go to? I don't see anything on the other side. So what is that? And then if you ask to go in and look at that, then again, this is where that respect and curiosity, you have a good relationship and they're like, oh yeah, they'll tell you all about it. And I'm like, well, okay, so let's just back up a minute. We can't do this. And again, it's explaining why in the best manner to not humiliate the folks and things like that, because we have to understand we all have different worldviews and we come from different cultures and experiences. But here in this situation, we cannot do this because there's rules. And again, it's awkward. Sometimes, sometimes it's hard not to laugh. Sometimes it's like, wait, what is exactly happening?
What is happening here? What were they? Inquiry minds have to ask. What were they slaughtering back there?
So chickens and goats. What was the things to be slaughtered? And again, it's very abnormal for us here, but in other countries, that's not exactly a rarity.
But the chicken, I like.
Fresh.
I can get the chicken. I get maybe like because that's definitely around the world. You prep your own chicken, but a goat's a pretty serious animal to slaughter in the back of a restaurant.
Well, it happens. This individual facility also had a grocery store that was owned by the same person next to it. And so they would just share supplies. So there was fresh meat in the grocery store, but they would also use that store to stock the restaurant as well. So
people do
very interesting
the
times.
Craziest things. And when the peeing in the floor drain, I learned something that depressed me about civilization today is that apparently it's more common than I thought. But I guess that's a high probability for a twofer violation, right? I'm not sure actually what you'd mark on the sheet, but I know peeing in the floor drain is a violation. And then if they don't wash their hands after they use the drain, that's the bonus violation, right?
Well, yeah, and it goes, yes, there's a whole host of violations that, those can go, again, you're not washing your hands, improper things. There's been people sleeping in the kitchens. Like sometimes they have cots because I guess, they work a lot or they live there, there may be a cot of somebody sleeping. And, there's been all kinds of things from sleeping to fornication in the office. We get lots of sexual claims of like complaints, like they're having sex on the prep table. And, first off, I'm like, did they sanitize it after they,
Well,
okay,
let's hope so. Wow.
Yeah, all sorts of things.
And those are complaints from the public, which presumably means they claim they observed it or witnessed it, right?
Yes. And sometimes they'll send videos. I mean, everybody having a cell phone now, sometimes it can be, great. Sometimes it can be like, wow, I wish I didn't see that. But it definitely, when it comes to going into a facility and addressing the issue, it does really lend to a faster conversation. It's, well, no, that didn't happen. Well, this kind of looks like you. So it makes a shorter conversation. And then we just work on why we shouldn't do that.
I'm pretty sure that's you, just with less clothes on. That is insane. And the person taking the bath, I'm trying to still, going back to story number 2 that you had, how do you contort yourself into a 3-compartment sink? That would be exceedingly uncomfortable, would it not?
Well, I think that's the more aged person of us thinking about that. But, you have to realize there's a lot of very young folks. And, again, they do a lot of things that I can't imagine doing, but I don't know, think back to whenever we're very young, and of course there wasn't videos around to tell
Right.
the
Thank
tale,
God
but
for
so who
that,
knows?
right? Like there's stuff that doesn't follow us that the next generation, they're screwed.
Yeah, exactly. Everything they do is recorded now, and it has been for a little bit. And so again, I just think there's this attempt to get more and more. It's kind of like the licking of the ice cream that happened a while back. They were videoing themselves licking the ice cream and then putting it
Yes.
back.
Yes. Yeah, they'd open it, take it out of the freezer case, right? Lick it, put it back.
Yes.
Almost like a weird spinoff of like a Tide Pod challenge or something, just grosser.
Yeah, there's a lot of interesting things that I won't even claim to understand. But again, and it just puts things in your mind, it goes back to, it may be fun, but think back to the adulteration of Tylenol back in the 80s.
Hmm.
Those things could happen again. And so fortunately, our manufacturers have put a lot of effort into trying to prevent and protect our food and things, because what if it wasn't just someone licking it, but then they were putting chemicals or something? People actually died from the Tylenol,
They did. And to this
incident.
day, I was reading an article about it recently because that was in the 80s. They never arrested anybody in conjunction with that, which is actually really terrifying if you think about it, because people did die. This has been the best hour plus. Sarah Jensen Ninja. I actually like that. You could put that in parentheses on your business card after director and assistant health commissioner, but a voice that definitely should be heard. Thank you so much for taking the time to chat today. And I know everybody's going to really enjoy listening to it and learn a lot. We will post your contact information and details in the description with the episode. And so as you continue on with your data analysis of the Austin thing that we covered, et cetera, I hope that you'll come back at some point and give us an update as you learn more. And I think there'll be a lot of other people that'll be looking forward to that as well.
Absolutely. Thank you for having me on. And again, I welcome everyone to join me on LinkedIn or wherever you would like to connect, and so we can chat a little bit more.
Absolutely. Please connect with her. Details in the description of the video. Sarah Jensen, thank you so much. Director, Franklin County Health Department and Assistant Health Commissioner. Thank you all so much for all of the time that you spend with us, including today, Beyond Data Management podcast. Looking forward to many more from here. So join us next week for another episode of Beyond Data Management powered by HS GovTech. Until then, I'm your host, Cameron Garrison. Thank you so much for joining us today.